You know those stories you hear about miracle cures,
Mm-hmm.
especially when it comes to something as tough as severe depression. But then what happens when you hear a drug used in veterinary medicine, like, or even as a party drug, starts to get some buzz as a treatment?
Right.
That's when things get really interesting.
Yeah.
And that's where we have to be cautiously optimistic.
Huh?
Like that, this is what we're diving into today.
Okay.
Ketamine as a treatment for like really severe treatment-resistant depression.
Interesting.
Yeah, we're looking at an article about Dr. Bobby Vithlingam. She's a psychiatrist using ketamine, but in a super controlled setting.
Okay.
And she's getting some pretty amazing results. But she's also like the first one to say, hey, we got to be careful. We have to understand the risks.
Right.
So our mission today is this. How does ketamine work for depression? Who could it help? And how do we balance all the hope it offers with what it actually is?
Yeah, I mean, ketamine has like such a diverse background.
Right.
It started in veterinary medicine back in the 60s, and it even got on the World Health Organization's list of essential medicines.
Wow.
But it's also been used recreationally for the psychoactive effects. So we're talking about something with a real double life here.
Right. It's not every day you hear about like an animal tranquilizer that's also a club drug and then suddenly is being researched as a breakthrough for mental health.
Yeah.
It's a wild ride.
It is a very unusual path. And what makes ketamine so interesting for depression is it works so differently from those typical antidepressants,
Okay.
like your Prozac and Zoloft.
Right.
They work mostly on like serotonin and norepinephrine. Ketamine, not so much.
So for someone who's like tried all the usual options and nothing's worked, this is a really big deal.
Absolutely. Dr. Vithlingam even calls it pharmacologically novel.
Okay.
So it's not just a tweaked version of what we already have, you know? It's working in totally different ways in the brain. And that's a huge deal when so many people have depression that just doesn't respond to anything.
It's kind of shocking to see that fewer than 15% of those people actually see lasting improvement with the normal antidepressants.
Yeah.
That's a lot of people feeling hopeless.
It really is. And that's where ketamine comes in. It offers some real hope. Especially think about it when you have someone who's suicidal.
Right, right.
Antidepressants can take weeks to work, sometimes months, but ketamine, sometimes it can work within hours.
Wow. Yeah, that speed is like crucial in a crisis.
Yeah.
But with any drug this powerful, we got to talk about the downsides.
Yeah, of course. Ketamine shows a lot of promise, but we can't forget to balance that with a realistic view.
Right.
A big concern is what it does to your heart. It can make your heart beat faster and your blood pressure goes up.
Oh.
So if someone already has heart problems, it might not be safe.
That's where that careful patient selection comes in, like Dr. Vislingam talks about.
Exactly. A thorough checkup beforehand is key. She makes it very clear. Ketamine should only be given by trained medical professionals.
Okay.
And in a place where they can handle any problems that come up.
That makes a lot of sense. Are there other risks to think about?
Well, using ketamine for a long time has been linked to problems with your urinary tract and even your kidneys.
Oh, wow.
And it's also not safe for pregnant or breastfeeding women.
So definitely not something to take lightly. Talking honestly with your doctor is super important.
Absolutely. It's about weighing the good and the bad together and making informed choices as a team. Now, if someone does decide to try ketamine, there are some things to keep in mind. We've already touched on this, but it has to be given by a medical professional, someone trained to do it.
And the article mentioned having like advanced cardiac life support on hand too.
Yeah, just in case. The risk of serious issues is low,
Okay.
but it's better to be ready.
Right.
And, even though the chance of psychosis is small, it's still important to have a psychiatrist involved the whole time, making sure the patient is okay.
Makes sense. What about those dissociative effects of ketamine? Do people need to worry about that during treatment?
That's a great question. And this goes back to knowing the difference between using it recreationally and medically. Ketamine can make you feel detached from reality,
Right.
especially at higher doses, like when they use it for anesthesia. But you don't need those effects for it to help with depression.
So you can get the mood boost without feeling like completely out of it.
Exactly. We want to find that dose that helps you feel better without the intense dissociation. And even though ketamine's effects don't last that long, you can't drive or operate machinery right after treatment. Your thinking is still a little fuzzy.
So it's like a mini recovery period.
You could say that, yeah. And just a quick note, the article mentions that intravenous infusions work best for severe depression. That's the most effective way to get the ketamine.
Interesting. So different approaches for different people. How long does the relief from ketamine last? Is it like a quick fix or is there more to it?
It's definitely more than a quick fix. It gives you relief for a while, maybe a short time, maybe a medium amount of time. It's not like you take it once and depression gone. It's more like a break from how intense the depression is. So you can use that time to make real progress with other treatments.
It's like pressing pause, giving you a chance to breathe and figure things out.
Yeah, that's a good way to put it. The article really stresses that you need continued mental health support even after ketamine. It's a crucial part of getting better long term.
Okay. So we've talked about the possible good stuff, the risks, and how it's given. But there's one question that a lot of people are probably thinking about, especially because of ketamine as a party drug. What about addiction?
I understand why people worry about that. It makes total sense. And Dr. Willem talks about this directly. What's great is studies don't show any higher risk of addiction after ketamine treatment.
Yeah, that's huge. It really shows how different it is when it's used medically and controlled. But it makes you think, if ketamine can change your mood so much without being addictive, what does that tell us about how depression works in the first place?
It's a good question. It really makes you wonder. Yeah, it really does challenge what we thought we knew, right? If something like ketamine works so differently from the usual antidepressants, but still has a big impact on mood,
Yeah.
it makes you wonder if we've been approaching depression the wrong way all along.
It's like we're trying to solve a puzzle, but we're missing half the pieces. Ketamine is like working on completely different pathways in the brain.
Right.
So what does that tell us about the puzzle itself?
That's a great way to put it. It suggests there's this whole other side to depression that we're just starting to understand. Ketamine is giving us a clue, opening up new ways to think about research.
So we're talking about like a whole new way of looking at and treating depression.
Maybe, yeah. And that's what makes all of this so exciting. We're on the edge of some pretty groundbreaking discoveries, but remember, with any new treatment, especially one like ketamine,
Right.
we have to balance the excitement with caution. We need more research.
Absolutely. But before we jump ahead, let's go back to those risks we mentioned. You talked about psychosis, and I think that can be a scary word for people.
I know.
Can you explain what that might look like with ketamine treatment?
Sure. When we talk about psychosis here, we mean a temporary state,
Okay.
where someone might have hallucinations, delusions, or a distorted view of reality. But it's important to say the risk of this with ketamine treatment is really low.
Okay, that's good to hear.
Mhm.
But what about those who do experience it? How do you handle that?
That's a great question. The most important thing is choosing the right patients and keeping a close eye on them. We look for any history of psychosis or other things that might make the risk higher. And during treatment, we're watching them closely.
Okay.
And if we see any signs of psychosis, the medical team knows exactly what to do. The good news is, even when it happens, it usually doesn't last long. With some support, it goes away pretty quickly.
So it doesn't usually stick around after the treatment?
Not typically, and we need to be clear about the difference between the psychosis you might see with recreational ketamine use at really high doses, which can be much more intense and unpredictable,
Okay.
compared to the very low doses we use for treatment in a controlled setting. These are totally different situations.
Gotcha. Speaking of those doses used for treatment, I know there's been talk about ketamine's dissociative properties, even at those lower levels. What exactly does that mean, and should people be concerned?
It's a common worry for sure. When we say dissociative, we mean that feeling of being detached from reality, like you're outside of your own body, just watching.
Right.
It can happen with ketamine, even at lower doses. But remember, we aren't trying to cause those intense dissociative experiences like with recreational use.
Right.
The goal of treatment is to find the right dose where it helps with depression without causing that much dissociation.
So finding that balance, getting the good effects without the bad ones.
Exactly. And that's why having a skilled medical professional giving the treatment is so important.
Right.
They're always watching how the patient responds, adjusting the dose to get that perfect balance.
Makes sense. But even then, I imagine there are still side effects to watch out for.
Yeah, even with the right dose, some people might feel nauseous, dizzy, or have changes in their blood pressure. That's why it's so important to keep a close eye on them. The medical team can deal with those side effects quickly and make sure the patient is safe and comfortable the whole time.
Okay, so we've talked about some of the risks, but I don't want to forget about the big picture. For someone struggling with severe depression that nothing seems to help, the idea of finding relief with ketamine can be a huge source of hope.
Absolutely. And those potential benefits are really important. We know ketamine works fast, sometimes in just a few hours. That's a huge difference from regular antidepressants, which can take weeks or months to do anything.
Yeah,
That quick action can be life-changing, especially for someone in a crisis.
absolutely. And beyond that initial relief, it seems ketamine can actually help reset those brain circuits that get stuck in negative thinking and hopelessness.
Exactly. It's not just covering up the symptoms. It might actually be tackling how depression works in the brain.
So we're not just masking the symptoms, it might actually be changing how depression works in the brain.
Yeah, that's the idea. And this is where things get really fascinating scientifically. We're seeing signs that ketamine might be encouraging neuroplasticity. It's like rewiring the brain to allow for more positive thoughts and emotions.
Neuroplasticity, that's the brain's ability to change and adapt, right?
That's it. And this is one of the main ways ketamine seems so different from those typical antidepressants. It's not just messing with neurotransmitter levels, it's changing how the brain is structured and how it works.
That's amazing. So ketamine is like hitting the reset button for the brain, helping it create new, healthier pathways. But if it's working on such a deep level, does that mean the effects last? Or do people need ongoing treatment?
That's the big question. And the honest answer is we don't know for sure yet. We know that ketamine's effects usually don't last that long, maybe a few days to a couple weeks. But the hope is, with repeated treatments, we can create more permanent changes in the brain and offer relief that lasts much longer.
So it's not just a one-time thing. It's more about laying the groundwork for lasting improvement.
Exactly. And that's where having a complete treatment plan is so important. Ketamine isn't a cure-all. It's a tool that can be really powerful when it's part of a bigger approach that includes therapy, lifestyle changes, and ongoing support.
It's about giving someone the space they need to actually engage with those other therapies in a more meaningful way.
You got it. It's also about being realistic. Ketamine isn't magic. It won't make all your problems go away instantly, but it can offer a change in how you see things, a reason to believe that things can get better, and a renewed sense of possibility.
Like it's a lifeline, giving you a chance to stop struggling and actually start swimming toward shore.
That's a great way to put it, and it's something that really speaks to people who have been battling severe depression for a long time. That feeling of finally having something to hold on to, a reason to believe things can change, it can be so powerful.
And I can imagine that feeling of hope can really motivate people, make them more open to other kinds of treatments and support.
Absolutely. It's about grabbing onto that positive momentum, building on those changes, and helping people be part of their own healing process.
Now, we've been focusing on how ketamine helps individuals, but looking at the bigger picture, what does this potential shift in how we see depression mean for society as a whole?
That's a great question. One of the most important things, I think, is that it could help get rid of the stigma around mental illness.
Right.
The fact that ketamine can work for severe depression when nothing else has challenges that old idea that it's all about willpower or a simple chemical imbalance.
It reminds us that the brain is complicated
Yeah.
and mental illness is just as real as any physical illness.
Exactly. And if ketamine can work when other treatments fail, it forces us to have a new conversation about mental health and the need for treatments that actually work and are available to everyone.
It's a message of hope, not just for people with depression, but for everyone.
I agree. It highlights how important it is to keep researching and to be open-minded about mental health. There's still so much we don't know, but with each new discovery, we're getting closer to understanding how the brain works and finding ways to help people who are suffering.
I am so excited about how ketamine could change mental health treatment. But like we've been talking about, we need to be both enthusiastic and cautious.
I agree completely. It's a powerful tool that needs to be used carefully and responsibly, and we have to keep doing research to make sure it's safe and effective.
And like with any medical treatment, honest conversations between doctors and patients are crucial so people can make informed decisions and get the care that's right for them. Before we finish this fascinating discussion, I want to go back to something you mentioned earlier, the idea that ketamine can promote neuroplasticity,
Right.
that we can rewire our brains to create better, more positive patterns. It's such an interesting idea.
It is, isn't it? And it makes you think, if ketamine can do this, what else is out there that we haven't discovered yet? What other amazing things can our brains do?
Those are some great questions. It reminds us that we're always learning and discovering new things. There's always more to explore, more to understand, and more ways to help people live healthier and happier lives.
I couldn't agree more. Mental health is a field that's constantly changing, and I think we're about to see some incredible discoveries that will completely change how we see and treat these conditions.
Okay, so All of this is amazing and exciting. But for people dealing with severe depression right now,
Right.
all this talk about neuroplasticity and changing how we view things might feel pretty far removed from their everyday lives.
You're right. It's important to remember the real experiences of people who are struggling with depression. It's a serious and debilitating illness.
So let's talk about that. What
Yeah.
would you say to someone listening right now who's tried all the meds, the therapies, the lifestyle changes, and still nothing's worked?
Yeah.
Someone who's just exhausted, feeling hopeless, maybe even skeptical about another potential breakthrough.
I would start by acknowledging their pain and frustration and their skepticism, too. It's completely normal to feel that way after struggling for so long and not finding answers.
Absolutely.
And I'd emphasize that even though ketamine isn't a miracle cure, it does offer a possibility, a glimmer of hope for people who haven't gotten better with anything else.
It's like offering a lifeline, a chance to take a break from the struggle and actually start moving forward.
Exactly. I would encourage them to learn as much as they can about ketamine treatment, talk to their doctor, and really think about the pros and cons. It's not a decision to be made lightly, but it's definitely worth exploring with an open mind and a sense of hope.
Yeah, it's like this weird mix of like, okay, maybe this could be it, but also, what if it's not?
Yeah.
After so many letdowns.
Totally. And those feelings are real. It's not about pretending everything's rosy or ignoring how tough treatment-resistant depression is. It's more like, how can we look at this new option with, cautious optimism? Ketamine's a tool, not a magic solution.
Yeah, not going to wipe everything away instantly. It's more about making a change, opening a door to actually getting better.
Exactly. And everyone's different. What works for one person might not work for another. There's no one-size-fits-all thing in mental health.
And that's where having a really good mental health professional is key. They can help you figure out if ketamine is even right for you and make sure it's part of a bigger treatment plan.
Absolutely. It's a team effort, you and your doctor talking openly, finding the right approach that works for you and your situation.
So it's more than just the ketamine itself. It's about the whole support system around it.
Exactly. It's about making a space where healing can happen, where you feel safe, supported, and in control of your recovery. And, recovery isn't a finish line, it's a journey. There will be good days and bad days, setbacks and progress. But with the right people and resources, you can handle those bumps and get to a better place.
Speaking of resources, I know getting mental health care, especially treatments like ketamine, can be hard for a lot of people. Like maybe they can't afford it or it's not available where they live. What advice would you give someone who's interested but hitting those kinds of roadblocks?
That's a really important issue. Access to care is a big problem. We need to talk about it more. I'd say start by talking to your regular doctor or therapist.
Okay.
They can connect you with mental health experts who offer ketamine treatment and maybe help you figure out insurance stuff too.
So it's about being your own advocate, asking questions, and looking at all the options.
Exactly. And don't be afraid to reach out to support groups or online communities. There are tons of people out there who care about mental health and want to help others get the care they need. You're not alone in this.
And even if ketamine isn't the right fit or you can't access it, there are other ways to heal and find well-being.
Absolutely. There's no magic answer for everyone, but the key is to never lose hope. Keep searching, keep learning, and keep reaching out for help.
That's a great point. Well, on that note of hope, I think it's time to wrap up our deep dive into ketamine for treatment-resistant depression. It's been fascinating, hasn't it?
It has.
We've talked about the potential, the risks, the science, and the real-life stories. But I think the biggest takeaway is even when things are really hard, there's always reason to believe in healing and a better future.
I agree. Mental health is a field that's always growing, and with every new discovery, we get closer to understanding the brain and helping people who are suffering.
Thank you so much for sharing your knowledge and insights. This has been really eye-opening.
My pleasure.
And to everyone listening, thank you for joining us. We hope this deep dive gave you some useful info, made you curious, and maybe even sparked a little hope. Remember, knowing more is always a good thing, and just being part of these conversations helps break down stigma and create a world where people struggling with mental health feel supported and understood. So keep asking questions, keep exploring, and keep sharing your experiences. Your voice matters. Until next time, stay curious and take care.